welcome to the Stroke Recovery Group. I'm so glad you're here. Hello everyone, welcome to the Stroke Recovery Group from I Care for Your Brain. My name is Dr. Sullivan and I'm going to be with you for the next 10 sessions where we go through the 10 rules of rehab. Are you ready to get started? Let's go. I am a board certified neuropsychologist. I have a practice here in Pinehurst named Pinehurst Neuropsychology. I have been working with folks with stroke and their family for many, many years, and I'm very excited to go through these lessons with you in the next 10 sessions. We are here because we need to improve post-stroke care. People who have a stroke consistently rate their time in acute medical centers and rehabs with very high satisfaction scores. Nationwide, unfortunately, patient satisfaction goes down quite a bit once people return home. The more severe the post-stroke disability, the more unmet needs the stroke person is going to have. What we really care about is meeting these unmet needs, and we care so much because it just makes all of the post-stroke recovery more difficult, and it exacerbates anxiety, which can really distract you from all the hard work of your rehab. 80% of people who've had a stroke report having a significant unmet need in two areas: education and support. It is a cruel myth that stroke recovery only lasts 1 to 2 years. The truth is that recovery is a lifelong, never-ending process. But what determines how well you're going to get is what you do after your stroke. Post-stroke care really must include 3 important things. The first one is you need evidence-based strategies, not for just recovering your brain health, your neurological health, but also your emotional health, your psychological health. A stroke is not just traumatic to your brain. A stroke can oftentimes be traumatic to you as a person and the people that love you. We also need personalized support tools. Every stroke is different, and we can't come at you with a series of recommendations that we think would work for everyone. We really need to identify the impact of your specific stroke, your specific recovery goals, track your progress, help you stay motivated, focused, and keep a positive mindset. We also need to give you empowerment tools. You are going to have to learn to be an advocate for the care that you deserve. But who is telling you all of these different things that you need to do to recover all of the parts of you that have been impacted by your stroke? I took this question quite seriously a few years ago and really felt that I had a responsibility to do better and contribute to better post-stroke care. So my solution was to write the I Care for Your Brain Interactive Stroke Recovery Guide, which we have right here. At the heart of this guide are what I call the 10 rules of rehab. And to find these rules, I searched through decades of peer-reviewed scientific articles to identify the 10 concepts that most drive people towards a successful recovery, no matter what post-stroke symptom you are working on. These are the rules that the world's leading brain scientists know all about, but too often they don't trickle down to the very people that they would benefit most: stroke survivors. So what we're going to do in the next 10 sessions is we are going to go through each one of these rules session by session, about an hour each, and we're going to take a deep dive into helping you understand exactly why they are a very important principle of brain recovery, and most importantly, how I can help you apply them to your personal situation. So rule 1 is called make your map. And what we mean by this is that you need to understand exactly where you're at in your personal recovery and where it is that you want to go. Rule number 2 is build on what's familiar. And what I mean by this is that we need to personalize your stroke care. We need to help you bring more of you into this recovery journey. Rule number 3 is repetition and consistency. We're going to talk a lot about neuroplasticity in this recovery group, and repetition and consistency are really the fuel that keep neuroplasticity going. So when I say neuroplasticity, what I mean is that your brain has the amazing ability to actually heal itself. Rule number 4 is harness your creative power. Rehab is tough work. If we don't help you make it interesting and innovative and fun and rewarding, it's going to be very easy to lose your steam to keep going at the level you're going to learn you need to go to get the very best recovery. Rule number 5 is we're going to talk all about sleep. Sleep is very commonly disrupted after a stroke, and it is absolutely one of the pinnacles of stroke recovery. We're going to teach you how to work as hard as you need to make the very best recovery, but I'm also going to teach you how to rest and sleep in a very effective way to get all the benefits of that hard work. The two really go hand in hand. Rule number 6 is we're going to teach you how to increase your emotional resilience. One of the things you're going to find in this series is that we're not just talking about brain. Brain does not exist in and of itself. We're going to be talking a lot about you, your spirit, your heart, your mind, your family, your people. And one of the things we have to really help you understand is coping. Coping with what has changed, coping with how life is different, coping with the story of what's happening with you. And so we're going to talk a lot about positive coping in that session. Number 7 is supporting those who support you. We do not recover in a vacuum. We are deeply social creatures. And during times of stress and difficulty, it really is our people, our community, our village that comes out to support us. This may be a family member, this may be a therapist, this may be your doctors, it might be another stroke survivor, or it also may just be you. But we have to talk about self-care and the way to show gratitude to our team. Rule number 8 is to acknowledge your trauma. One of the things I like most about our series is that we're going to be taking the emotional, the mental health side of stroke recovery very seriously. We are going to aspire to bring all of you into this conversation, not just the brain recovery. Rule number 9 is we are going to teach you how to insist on follow-up care. Again, remember, people are quite happy when they're in the hospital system. It's when they go home and they really have to try to patch together their recovery where people often lose their way and feel lost. So my job is to give you scripts, give you empowerment statements to really help you understand that you have a right to a comprehensive treatment plan and how to get that plan. And rule number 10, we are going to end on the transformational power of acceptance. All too often, when we are talking about stroke recovery, we forget that the truth is that despite the fact that there's a lot of recovery that can happen, for many people, particularly with a bigger stroke, there is a set of functions, a set of skills that you may never get back the way you had it before. And so we really do need to give you the psychological tools to be able to live with that and to not resist that too much, that it actually becomes a barrier to other types of recovery that you could have. So every time we meet, we're going to go through one of these rules, and it's going to be a wonderful education and empowerment experience. Once you understand these 10 rules of rehab, you will not have to wonder anymore, am I doing everything in order to get as well as I could be? You are going to understand the rules, how to apply them, and really the purpose of all of this is to put you back in the driver's seat. You will feel in control once you understand all of this information. Now, here was my challenge in writing the Interactive Stroke Recovery Guide and designing this group for you, is that yes, we have 10 universal rules that we know contribute to brain recovery, but the truth is that every stroke is also very different. And so the challenge is, how do we make something both universal, but also personalized? And the way that we address this is that we have developed 10 interactive worksheets that go along with every session that are really going to help you personalize the knowledge that you're going to learn, apply the information to your specific stroke symptoms, process your unique stroke-related trauma. No two people's stroke stories are the same, and guide you towards the very best recovery that you can possibly achieve. So how did this stroke recovery group come to be? Well, I just told you we wrote the Stroke Recovery Guide a couple years ago, but about a few months ago, we had this idea that we really wanted to bring it to life. Some people are visual learners. Some people would really benefit by getting together in a physical space with other stroke survivors. And so we approached the Foundation of First Health and asked them for their support in making this dream a reality. And that's exactly what they have helped us to do. We have been meeting here at Clara's house for the last few months. Unfortunately, we were interrupted by the COVID pandemic, but we have recommitted to the group and are now going to be offering it in this video series. The first thing I want to help you think about as we start this journey is really, why are you here? So we call this, what is your why? And what I mean by that is, what is your motivation for wanting to get better? Motivation is the fuel that really keeps us going when times get tough. So I really would like you to spend some time thinking about the top 2 reasons that you want to participate in this group. So there can be reasons that you would like to do for you. Perhaps some of your reasons relate to your spouse. Sometimes we want to do things for the greater good of our community. And really, the better we are as individuals, the better citizens of the world we can be. So you might have reasons in all of those areas, but what I'd like you to do is articulate these reasons, post them around your house, and that's going to be the thing you return to remind yourself of your why as we go through all of this information. This information is a lot. I respect that you can handle high-level scientific information when it's explained properly, and it is going to take effort in order to achieve these rules of rehab that we are going to go through. So let's let the learning begin. The first thing we're going to talk about is, what is a stroke? You know this from a first-hand experience. If you were to look in medical books, what you'd find is that it can be defined simply as an interruption in the blood supply to the brain, commonly measured in terms of pictures of the brain, neuroimages, a CT scan, or an MRI scan, in which the physical damage of the brain is assessed. At its most basic explanation, a stroke is either too little blood in a part of the brain or too much blood in a part of the brain. The reason that we see damage from strokes is that when the blood can't get through, the brain cannot get its 2 basic fuels that it needs to live: oxygen and glucose, which are carried in the blood. What's interesting about brain cells, or called neurons, is that they can only store their fuel really for a few minutes. And so after a few minutes, what we're going to start to see is initially just a couple brain cells having some trouble, then eventually a few brain cells dying. And the more time that goes by, what we see is bigger and bigger networks of brain cells unfortunately die. So after about 5 minutes of poor or no blood flow, we know that this is going to have some negative effect on the brain. This largely depends on the health of the brain matter that was supplied by that blood vessel. So if you've had a very healthy brain, and unfortunately you've had a stroke, then chances are you're going to have less brain damage. If unfortunately you've had a few strokes before, or you've had some other brain health challenges, the stroke is probably going to affect you more significantly. Once we get into about 7 or 9 minutes of no blood flow to the brain, that's when we really start to see significant damage. And this is when bigger and bigger networks of the brain start to die. After 9 minutes, we know that there can be very significant death in brain cells in larger networks of the brain. The size and the location of your stroke in the brain, where it happened, will determine the specific symptoms that affect you. The symptoms can either be caused by direct damage, which makes sense, right? If that part of the brain has lost brain cells, well, the function of that part of the brain is going to suffer. But what a lot of people don't understand is that we actually see indirect damage in stroke as well. So what that means is that all parts of the brain are interconnected. They're very, very interwoven networks, where one part of the brain, maybe in the left frontal lobe, is connected to the back part of the brain called the right cerebellum. And they're connected, you can think, kind of on a series of rubber bands. And so if the rubber band gets cut in one area, then unfortunately that whole network is offline. So a lot of times this is where good assessments come in. It's very important to understand not only your direct damage from your stroke, but you might also be having some indirect damage. A stroke is the result of a problem in the vascular system, and so we need to understand that system in good detail. Your vascular system is made up of your heart, your arteries, your veins, and your capillaries, and their main job is to carry blood from the heart through a complex interconnected system. In the brain, blood vessels circulate and transport the fuels that we need to think, move, and to live, which again are oxygen and glucose. When blood vessels are healthy and they're well connected, there are 4 characteristics of them. The first one is that they are nice and open and allow for the free movement of blood throughout the network of blood vessels that provide this oxygen and glucose. Number 2 is that the blood vessels are strong yet elastic and flexible, and this helps blood flow increase or decrease based on what we're doing at any given time. When the body needs a lot of fuel, our blood vessels are actually able to contract on their own, allowing allowing for more blood flow. Kind of think of like a garden hose. When you want more forceful water to come out, you put your finger over the spout and it makes it come out more intensely. Well, blood vessels have the ability when they're healthy to do that on their own. Number 3 is that they're smooth on the inside. There's no barriers. They are able to get blood in and out without having to go over any obstructions. Number 4 is that they are coordinated. They work together as a team to bring all of the important fuel into the brain cells, carrying oxygenated blood away from the heart and deoxygenated blood back into the heart. So now I want to talk about the 4 different types of strokes, and I want you to start thinking about your personal stroke experience. Which one of these best describes you? Number 1 is the ischemic stroke. This is what most of you probably have had. About 80% of people have had an ischemic stroke. This happens when something blocks the flow of blood to a part of the brain. This can be a blood clot, this can be a fatty deposit. The most common subtypes of ischemic strokes are what we call thrombotic and embolic, and that simply means that you've had a blood clot forming in one part of your body, like your lungs, your carotid artery, and it's traveled all the way up to the brain. Hemorrhagic strokes are the second most common type, and this is in about 20% of people. This happens when a blood vessel in your brain bursts or when a weakened blood vessel leaks blood into your brain. The most common types of hemorrhagic strokes are intracerebral and subarachnoid. And what we mean by that is intracerebral is actually in your brain, and the subarachnoid is actually in the tiny layers that sit between your skull and your brain. We have 3 types of webbing there that helps to cushion the brain, helps to support the immune system that exists in the brain for cleaning things up, and helps to provide a little bit of a cushion so if we get hit in the brain, we don't get too much damage. The next one is a mini stroke. These strokes are sometimes called silent strokes. Typically, they have no symptoms. Sometimes they happen when people are sleeping. Sometimes they're just so mild and the symptoms are so subtle, almost undetectable, that you don't even know that you've had one. They're typically picked up on MRI scans or CT scans, and you might have been told that you have white spots in your brain. So all that means is that you have a history of a little tiny bit of very small blood vessels getting clogged up, typically from cholesterol. The next one is called a TIA. This is a transient ischemic attack, and I want you to focus on the T for transient. This fleeting type of stroke is due to a temporary blockage in a blood vessel that causes symptoms, but the symptoms stop after a few minutes or at most about an hour, and does not leave any permanent brain damage. So again, going back to the T, transient, what we mean by that is the symptoms come and go. If it was truly a TIA, you will not have any sign on a brain scan to suggest that there's been permanent damage. There are 5 most common risk factors for why people have stroke. And again, I want you to listen to my words and really start to think about how it applies to you. We are going to go through each one of these one by one. The first one we have is hypertension or high blood pressure. The second one we have is high cholesterol. The third one we have is type 2 diabetes. The fourth one is atrial fibrillation, and the fifth one is arterial dissection. So let's learn a little bit about what each one of those mean. So hypertension, also called high blood pressure, this is either damage can happen slowly over time or all of a sudden during a highly stressful event. And hypertension really hurts the brain because over time we can get a narrowing of the blood vessels, usually from cholesterol, that the heart then compensates by to getting around those barriers that exist in the blood vessels by pumping more blood, working harder and harder and harder. And that's really what blood pressure is when you measure it with a cuff when you go into the doctor, is what is the force of the blood coming through your blood vessels. This increased force, unfortunately, is damaging to that smooth lining on the inside of the blood vessels. And what we see is that friction can cause little tiny micro tears in the blood vessel. And what we really worry about is what gets caught in those tiny tears. What is kind of like a magnetic pull in those tears are the small fatty deposits, cholesterol plaques, that fill in those spaces that are left from the tears and turn into calcium deposits, causing the arteries to lose that elasticity that we just talked about. And they get hard and they get thick and further narrow, so it's harder for blood flow to get through. Next one is high cholesterol. A lot of you know about cholesterol, but I think it's helpful to really go through it so you can really wrap your head around it. Cholesterol moves in the blood in these little sphere-like protein particles called lipoproteins. There's two types of these particles. You've probably heard of them before, your HDL and your LDL. And it's really your ratio, the relationship between the HDL and the LDL, that determines your personal risk for high cholesterol affecting your brain. The LDL is what we consider the bad cholesterol. This is the junk that builds up on the inside of those blood vessel walls and can cause the damage by, of course, narrowing, blocking the blood flow, or also breaking off, flowing downstream until they find a small enough blood vessel to get caught in. The HDL is your good cholesterol. This is the stuff that you get when you eat avocados and olive oil and nuts. And why this is good is because these little particles actually go through the bloodstream and they remove cholesterol from the blood and help you get rid of it, which is exactly what we all want. The risk for stroke from high cholesterol comes when the blood vessels narrow to the point where they're going to block blood flow and cause an ischemic stroke, or when a piece of the cholesterol that was once lodged in a blood vessel breaks off and flows downstream. We call that the embolic stroke. With type 2 diabetes, what you really want to worry about is when your numbers are wildly up and down. If you have type 2 diabetes and it has been well controlled, that's really not a significant risk for stroke. What we really worry about is when the numbers go very high or very low. The reason we are concerned with type 2 diabetes and blood flow is that over time, the damage that can come from having too much sugar in your blood causes inflammation in the blood vessels. And if you remember, what we talked about is that blood vessels, when they're healthy, want to be really open because we want all that good blood flow going in and out. Well, it makes sense if something is inflamed, it's going to shrink a little bit, right? We get most concerned about the impact of inflammation in the body where the smallest blood vessels are. So you might imagine that some of the smallest blood vessels are in the brain, in the eyes, in the kidneys, and in the feet. So this is why oftentimes diabetes affects people in those areas, because those blood vessels are so tiny. They're about a quarter of the size of a strand of hair. They don't have much diameter to close up, and once they do, that's where we can find those little white spots in the brain I was talking about before. So remember that oxygen and glucose are the fuels, but here's the problem with brain cells. They cannot store them for a long enough period of time. So when we get very low spikes, the brain cells start to panic, and this is where the inflammation comes in because they're trying to bring in more glucose. Or when we get blood sugar levels that are too high, we also get the same panic with inflammation because now the body is trying to move out all of that extra glucose. This is a lot of work for blood vessels, and over time, there's a price to pay with damage. The greatest risk for stroke comes when someone has a variety of these risk factors, so high blood pressure, high cholesterol, and type 2 diabetes. And unfortunately, they do tend to travel together in a bit of a triad. So if you have either one of those, if you have multiple, if you have all of them, it's very, very important that you take them seriously and try to control them as best you can. The next one we're going to talk about is atrial fibrillation. This is the most common type of heartbeat irregularity. It's an abnormal, rapid electrical impulse that causes the heart to not contract fully. A lack of a regular contraction in the heartbeat makes it unable to completely empty out the chambers of the heart. Slowed or stagnant blood can cause a blood clot to form, and when that blood clot breaks off, because when the heart goes back into contraction, it can kind of shoot out what's in its chambers, this is where we can get an embolic stroke, and that blood clot easily travels up to the brain. The last one we're going to talk about is arterial dissections. This is a traumatic tear inside one of the blood vessels. It can either be in the carotid arteries in the front, it can be in the two vertebral arteries in the back, or oftentimes it can also be for a blood vessel directly in the brain. The tear can lead to a collection of blood between the layers of the blood vessel, causing a clot to form, and we call this a thrombus. Dissections can either be spontaneous or traumatic. So when they're spontaneous, this usually means that over time there's been some kind of a weakening of the blood vessel, and just through wear and tear, unfortunately, it maybe starts to split a little bit. Traumatic dissections can happen through things like chiropractic adjustments, weightlifting, something extremely physically strenuous in the moment. And I also wanted to quickly mention cryptogenic strokes. What does this mean? This means when no cause for your stroke can be readily identified. The cause of the stroke remains undetermined, which I can only imagine how frustrating that is, because when you know what caused your stroke, you have a target. You can identify interventions to reduce your risk of having another stroke. If you don't know what caused it, it is incredibly difficult to figure out how to avoid another stroke. This might be because the cause was transient, it might have been reversible, and now there's no evidence to suggest what it was. It might be that the doctors didn't turn over every rock and they don't know what the cause was. For many people who have a cryptogenic stroke, the cause remains unknown. About 1/3 of ischemic strokes are thought to have no known cause. This happens more typically in people who are under the age of 45. Once you've had a stroke, I hope that you understand how critically important it is to get to urgent medical care. As we like to say, time is brain. Once a stroke starts, it is critical to act quickly. I believe that once you've been through something in life, you are left with a certain responsibility to make sure that a similar thing does not happen to other people. So one of the things I want you to know about is the most up-to-date acronym for helping people understand the early signs of stroke. You might have heard of the acronym FAST. This was F for face, and we all know about a droop that typically happens in a stroke. A was for arms, if someone's having a difficult time using an arm. S was for speech, difficulty with talking. And T always means time, which means get yourself to emergency medicine immediately. But a few years ago, we decided to change this acronym and make it B FAST. And now we have B for balance and E for eyes. And the reason that we did this is because too many people who were coming in with what we call posterior strokes were being missed. Posterior means the back of the brain. And these folks were coming into emergency medicine and getting told they had a migraine headache, or perhaps they were under the influence of some type of substance, when the truth was they were actually having a stroke. And so now we know that using B FAST is the very best way to catch all of our people who are having stroke. Once you go through emergency medicine, this can be the ambulance, this can be the emergency room, someone driving you to the emergency room. Now you're in the hospital system, and how long you're going to stay in there really depends on the degree of your stroke and any of your personal medical needs. The average stay for an ischemic stroke is about 4 days. That goes up with hemorrhagic strokes when it becomes about 7 days. This is often an overwhelming time for you and your family. You may have very hazy memories of this time, or you may remember things in very painstaking detail. When you are in the hospital system, there's really 3 goals for your care. The first one is they want to give you a diagnosis of a stroke and what kind. Those determinations dictate if there's any emergency treatments that might help you, something like a TPA, a clot-busting drug. The next one is their main goal is to stabilize you. They are in the business of saving lives, and they want to do just that. Next, they start to think about what are the earliest treatments that we could do to minimize the damage from not enough blood flow to the brain or too much. Your recovery starts once you are stabilized and is going to continue for as long as you put work into your rehab. Recovery can take many forms. Perhaps you went to an inpatient rehab, maybe you went right home and started to do outpatient rehab, meaning you went to a physical therapy office, a speech therapy office. Some people transition from the hospital into an acute intensive inpatient rehab program. Some of you go home and do outpatient rehab, meaning you go to a physical therapy office, meaning you go to a speech therapist's office. Some of you go to skilled nursing for a short time or perhaps a longer time, depending on how much difficulty you're having. Some people just go home. Some people have families that are really guiding their rehab. And some of you are doing this all on your own. Post-stroke recovery is typically made up of 3 types of interventions that I want you to know about, because the people who do the best combine these 3 interventions and are focused on them as they work through their recovery. The first one is that your brain is capable of repairing and regrowing brain cells. That's pretty amazing, right? So an example of this would be to consistently work on hand stretching exercises as much as you can, and slowly over time, the reestablishment of brain cell connections between your hand and your brain. The next one is learning to compensate. You are able to learn how to use a non-injured part of your brain to take up the job of a previous part of the brain that's been damaged. So an example of this might be, instead of just remembering your doctor's appointments, now you have to use more of an organizational strategy and write things down in an appointment book. The next one is acceptance of these changes. So this means really changing your expectations, how you define success, focusing more on your remaining strengths and not your difficulties. So an example of this might be working hard to be okay with the fact that you can't tie your shoes anymore and you need to use Velcro shoes. All three of these interventions require that fancy word of neuroplasticity. So what does that word mean? It simply means that your brain has the extraordinary ability to reorganize and to grow new connections between brain cells, which leads us to the star of your recovery, your neurons. And I want to teach you a little bit about them so you can understand exactly what it is we're trying to do here. So I want you to look at this picture of a neuron in my slide. And what I want you to notice here are two parts of this brain cell. So first of all, we have more brain cells in our brain than we even have numbers for in our mathematical system, which is pretty amazing. So now start to imagine the connections between every one of these brain cells, and now we really go into infinity. We really don't know how many they are because it's an extraordinary number. But what we care about with neuroplasticity is not necessarily the whole brain cell. What we're really going to focus on is regrowth in two parts. So I want you to look at the very top part, which we call the dendrites. What the dendrites do, these little tiny little fingers that exist at the end of a brain cell, this is where we import communication from other brain cells. This is where we're touching other brain cells, just leaving a teeny tiny little gap for a chemical and an electrical communication to happen. Once we bring in all the information to the neuron, we basically summarize it and figure out what is the one message that this brain cell wants to pass along to the next neuron. And that's where we see the information go all the way down that myelin sheath, all the way down that long axon, the green part there, and it comes out on the other side called the synapse. So again, you might see that it's not just one little branch that's existing out there. We have maybe 6 or 7 of them. And this is where this one cell now exports the message to other neurons. So really what we're thinking about with neuroplasticity is how can we grow more connections? Now these dendrites and these synapses can actually extend very, very far in the brain. They can start in one hemisphere of the brain and actually travel all the way to the other. And it's their growth that we really need to focus on when we talk about how to recover from all types of brain injury, including stroke. So this reorganization, the growing of dendrites and synapses, this happens by rebuilding brain networks, rewiring brain networks. And you might be surprised to learn this. I want you to look at my picture here. And all of those little red dots are what we consider to be nodes or hubs where different information is stored. The networks come in when we connect those different hubs or nodes all together, and that really is responsible for a specific function or a skill that we do. So one example we might have is somewhere in your brain you know how to make an apple pie, okay? That knowledge, those memories related to an apple pie, are not just stored in one teeny tiny little part of your brain. They are stored in a distributed network like you see in my picture, okay? And this is hope for those of us who have a brain injury, because what this means, because stroke is a focal injury and typically happens to one part of our brain, that networks, because they're widely distributed, can be rebuilt. We just have to know what to do, right? So the brain is organized into these countless interconnected networks of brain cells, but what's really important that I want you to know is everyone's brain is unique based on their previous life experiences. And the things that we really think help organize our unique brain is our education, our interests, our hobbies, and our relationships. These networks start off pretty simple when we're a kid, and they get more and more complex and more redundant over time. So again, in the case of a stroke, we can either have direct damage to the network, or it can be that the access to that network is not readily available to us. It's kind of gone offline. And again, this is because a stroke is a focal injury. Remember this, a stroke did not happen to your whole brain. We have a whole rest of a healthy brain that we can work really hard with to try to teach it how to make those connections. And what we're talking about here again is that word neuroplasticity. So if we want to get even more scientific about it, we're really talking about axonal resprouting. So I want you to look at my picture here and I want you to see the process of neuroplasticity. We can go from a damaged brain cell there that only has the 4 little dendrites on the end, and over time, through very specific exercises, very specific things that we can put in the person's world, we can get regrowth on these brain cells. And over time, we can help them be restored to their original level of functioning. So you can see here in my picture, over time, we can get more and more sprouts on the end of these brain cells. What we are very focused on, of course, is how do we make this happen? This can happen spontaneously. The brain is incredibly smart and always wants to return to homeostasis. But what we're going to focus on in this stroke recovery group in our next 10 sessions is what are the specific things that you have control over that can promote this process. And what we know from the scientific literature is that neuroplasticity happens best when we put the person in what we call an enriched environment. And I want to teach you about enriched environments. So I want you to look at our 2 pictures here. We have got a rat in his cage all by himself over there on the left. And you can see he's all alone. He's got no toys. He's got no one to chat with. He only has water in his bottle, and he is unable to take any naps, and his sleep is disrupted about every 20 minutes. Then I want you to look on the other side, the bigger cage, and we have a variety of rats living together. A little rat party is happening in there, and they have not only water, but they get sugared milk. They have toys. They are interacting. They've established a hierarchy of who's the boss and who's the worker, and they have all sorts of stimulation. They are able to nap and sleep on demand. So what scientists do is they sacrifice these animals and they look at their brain underneath a microscope, and what they care about is the number and the strength of those connections, those dendrites. So I want you to look at that impoverished rat brain cell, and you can see it's got some dendrites, but it's rather spindly, right? Looks a little bit kind of weak. Look over there at the brain cell of the rat who was in the enriched environment with lots of social opportunities, with a variety of foods, with cognitive stimulation, and look how much more robust those dendrites are. So the question of stroke recovery is really, which brain cell do you want, right? So neuroscience tells us time and time again that the way to really promote brain recovery is by putting someone in what we call an enriched environment. And this is really quite simply 2 things. We need to surround the person with a complex and stimulating environment with periods of focused and repetitive activity, but also we need to balance that with periods of high quality rest, including REM and non-REM sleep. So that was our intro, okay? Now you are becoming more and more of an expert in stroke, and now we're going to take a step into the 10 rules of recovery. So are we ready to get started on this journey? I am definitely here for it. I hope you are too. Rule number 1 is to make your map. In order to become empowered in the stroke recovery journey, you are going to have to become an information gatherer. So the first thing I would like to support you in doing is getting a notebook, writing on it, my stroke recovery journey, and you're going to have this journal to write the most important things about your stroke recovery in here, and it's really going to be a testament to where you go in this recovery journey. There are a couple questions that I need you to understand about your personal stroke for us to move on to the next rules. The first one is you really need to understand what happened. I can't tell you how many patients of mine come in to see me and they don't really know about their stroke. They're not sure where in their brain they had it, they're not sure why they had it, and they're really unsure about how the stroke has affected them in a whole person perspective. This is changing, but historically we have really focused on physical symptoms after a stroke. It's kind of like if we can't see it, if we can't visualize it on an MRI, it's a little hard for doctors to pinpoint what it is. And so I think there's been a bit of an overemphasis on the physical side effects of stroke. But one of the things I'm going to encourage you to do in today's rule is to really try to spend some time thinking about how your stroke has impacted your whole person. And it's really not until we validate and document how you've been affected by the stroke that we can really understand where it is you need to go. And that's really the map that I'm talking about here. So the first question is, where in your brain did you have this stroke? I'd like you to look at my picture here of the brain, and this is just a couple of the structures that exist in a brain, and you might have had your stroke in any one of these. You can have had a stroke in what we call the cortex of your brain, which is that gray matter, kind of bumpy, slimy stuff you think of when you see a picture of the brain. You might have had it in the back part of your brain called the cerebellum, or a pons, or the medulla, or a brainstem. You might have had it in the middle part of your brain called the subcortical area. This is your basal ganglia, your thalamus. You really have a right to understand exactly where it is you had your stroke, because that will allow you to research and educate yourself about all the things that that part of the brain does. I'm a big believer in knowing this information because to me, it makes your stroke symptoms less of a mystery. You're going to feel a lot more empowered because you will have evidence to support why it is you're living through the circumstances you are now. How can you find this information? Well, requesting your medical records, I think, is something every stroke survivor should do. You can get your hospital records, you can go to your neurologist, and typically there will be information in there about exactly where it is you had your stroke. The next one is really understanding to the best of your ability why it is you had your stroke. So remember before we went through the 5 most common risk factors. You may or may not fall in that camp. It could be something completely different. If you don't know this, again, get these medical records. Ask your neurologist, ask your physician. A lot of times they understand this, but this information might not have trickled down to you. They might have told you or your family while you were in the hospital. That's not exactly a time where you are ready to take in complex information. Very important to me that you are respectfully assertive with your medical providers to figure out this information, because this is really going to help you with secondary stroke prevention and again put you in control about how this stroke has affected you. This next question is my favorite one. This is really taking the time to think about how this stroke has affected you as a whole person. So I want you to take a look here at my graphic, and in the middle we have impact of stroke. Now typically people are very clear on how they have been affected physically. Many times people have also been asked if they have any cognitive issues. Cognitive means your thinking, your word finding, your memory, multitasking. But what I typically find is that often there's not been enough focus, questions, assessment on these other areas of life, and they're really just as important. So my thought is that it's kind of on you to really articulate how it is you've been affected as a whole person, and then take some steps after that. So let's just go through these for a few minutes. The one right after cognitive is mood. So when I talk about mood, I'm talking about things like anxiety, depression. Very often, stroke is experienced by people as a traumatic event. A traumatic event is defined as something that came out of the blue, was life-threatening, and you responded to with a feeling of horror and helplessness. I think that defines many of you have experienced a stroke, and so post-stroke traumatic stress is a real and validated medical diagnosis. We're going to talk about that as we go through these series together. Behavior is more like how you act with other people, right? Sometimes after a stroke, people might say, they tell me I'm not the same person anymore, that I'm irritable, I'm short with people, I'm crying a lot. This is kind of the outward manifestation of our mood. The next one is social. We don't talk about this nearly enough. This is how differently you might feel being a part of a group, and perhaps also how people respond to you different socially. Many people are not well educated about stroke and the effects of stroke. And so sometimes, as much as people might care, they also might not know exactly the words or the gestures to make you feel better. And all too often we do hear that people start to become less and less social as they go through their stroke recovery. Next one is intimacy. This does not get talked about hardly at all. A stroke can absolutely change the way you feel in your own body, feelings of maybe being overwhelmed by having to experience intimacy with someone close to you. And this can really affect personal relationships, and we need to identify these issues more. The next one is financial. Having a stroke is expensive. expensive. You guys know that these medical bills can be out of control. A lot of you are seeking additional rehab, not through the traditional insurance-based healthcare system, and oftentimes this is self-pay. You have to pay on your own. And the last one is sensory. This is if you've been experiencing pain, if you have a visual issue. Some people have a hard time smelling or tasting food after they've had a stroke. And again, we really want you to take stock of these things for this reason. The reason is until we understand your map, where you are now, we're going to be walking in the dark trying to identify your recovery goals and figuring out exactly where it is you want to go in the future. So what I want you to do is look at this graph here, and I want you to get some ideas about where you might fall. Okay, in that interactive worksheet that we're going to be giving to you after our meeting today, you're going to get a copy of this and you can go through, work with a loved one, maybe even a therapist, to try to identify what are your opinions and what might they contribute to help you understand how the stroke has affected all of your person, okay? It can be hard to acknowledge the things that have changed, but I think that it is really an important step in your recovery because we don't want to leave any symptom behind, because we're going to be learning a lot about how it is that you can manage all of these symptoms. So what I mean by making a map is really knowing where you're at now and knowing exactly where it is you want to go for every post-stroke symptom that you have. And the way I want you to think about these two time points is this is your precious recovery between your two hands, where you're at now and exactly where it is you want to go. That's your recovery map of knowing how to get from point A to point B. So what I want you to do is, once you've identified these things that have changed or your symptoms, you are going to pursue a good assessment. So what do I mean by an assessment? Assessment is getting connected with an expert in that particular area, someone who maybe is in your community. You can ask for a referral from any of your physicians, and their job should be a specialist in that specific area. So we might say that you have a vision issue. Things don't look quite right. You can't quite see out of the left part of your visual field. Well, you can go to see a neuro-ophthalmologist, and they have expertise in that specific problem, and they can be a part of helping you make the map. They can tell you exactly where you're at right now and what are some realistic recommendations that you can take in order to get to where you want to be. So a good assessment should really do three things. The first one is it should really explain to you in detail why it is that something isn't working well. So for example, as a neuropsychologist, when people come to see me after a stroke and they are worried about memory, we do a very detailed assessment and we can determine what the exact cause of a memory problem is. Sometimes it's that the person's hearing has changed. Sometimes it's because they can't focus long enough on what's being said to make a memory of it. Sometimes people can make the memory, but they can't recall it on their own. They need some support. So in a good assessment, I'm able to give someone the feedback and say, your memory is actually working okay. I know it feels like it's not, but really the problem is that you've lost some hearing in the left ear, and before your stroke, you didn't have great hearing in your right ear. So we really need you to go to an audiologist and get that problem figured out. The next one is that an expert's job is to give you short and long-term recovery goals. Recovery often happens in very small baby steps. Occasionally, you might get a breakthrough and get a nice big piece of recovery in a very short amount of time. But typically, I really want to help you to start to fine-tune your recovery. Kind of think about it like a bricklayer, or that you're really going to be taking baby steps to get to your recovery goals. An expert's job is to also explain to you treatment options. They should really be able to tell you very specific therapies or ways to compensate in order to help you achieve your goals. So I have a list here of the ideal stroke care team. Now, all of you might not have access to these people, but I just wanted to have you have a list in order for you to understand what options are out there. So we go all the way through a neuropsychologist, a neurologist, a physiatrist who is an expert in rehab. Oftentimes people are quite helped by orthotics and prosthetics. Those are the people that can give you the gear, the braces, the products that might be able to help you. Occupational therapy, physical therapy, speech therapy, a counselor, someone objective to help you go through your symptoms with and process this experience. I put a massage therapist on here because I think it's really helpful for improving circulation, muscle functioning, relaxation, helping you let your guard down a little bit, having a pleasant pleasurable experience with your body instead of thinking about it as something you need to kind of fight for all the time. And the two other groups here in your ideal stroke recovery team are really you and your family, right? And so you are the people that need to help keep you on track, make sure you get to see these experts, really give you the support and motivation that you need. I think your main job is to really try to have the best recovery mindset. How is it that you can stay positive and focused on getting back all that you can? So what I want you to ask yourself is, are there areas of my life yet that I have not validated as being impacted by my stroke before? Where is it that I might need to seek more care? And what we're going to do at the end of every session is we are going to close off with a self-empowerment statement. So what I want you to do is say this to yourself many, many times until we meet again. I deserve a treatment plan that addresses all of my symptoms. If after listening to me today, you maybe think back, I have really been focusing on my arm, but the truth is I also do have some pain in my leg. I have felt that my wife and I are having a hard time kind of connecting. I really want you to go back and re-energize that part of your rehab. Everything has to be on the table if we're really going to get you back into the very best shape that we possibly can. Okay, so remember, you deserve a treatment plan that addresses all of your symptoms. I hope that you'll come back and join me again for session number 2, where we go through the second rule of rehab, which is to build on what's familiar. This is when I'm going to teach you how to personalize your rehab. Remember that your brain was unique before this stroke. Your stroke is unique, and that means your recovery is going to be unique. So I want to teach you how to bring more of yourself into this recovery. Thank you guys so much, and I'll see you next time. Bye-bye.